Okay,
Okay,
recording
we're
in
ready?
progress.
Okay, so I put this together based on my own personal experiences and what I've done throughout the course of time for the last 57 years. Um, so the use and abuse of anabolic steroids, it's not cheating when everybody does it. That was a direct quote from Dr. Robert Kerr, who became very famous during the 88 Olympics in Seoul, Korea. And we'll discuss that in a little bit here as well.
I'll tell you some interesting stories about that guy.
Okay. Let's see. Why is this thing not cooperating? Here we go. Okay, the why. Okay. After 56 years of being a proud gym rat, I've experienced and witnessed the pros and cons of anabolic steroid use. My biggest fear today is the possible resurgence of anabolic steroids abuse. We live in a changing world. The changes today suggest a large market for what I call the microwave mentality. I need it now and I need it fast. With the college sports portal and NIL contracts, and who knows where this transgender nonsense is going to go. Pressure for success may encourage the appetite for quick results. I hope I'm wrong, but if I'm right, this is a good time to address the topic. Now, I want to stop there for a moment. And I got a phone call early this week. So I train a lot of these Polynesian kids, and one of them said, "Hey, Danny, one of the athletes got an offer." Well, he's a freshman. What do you mean he got an offer already? They offered him the University of Hawaii. And I thought, my God, when's this going to stop? Are we going to go down to the maternity wards and when they come out of the mother's womb, start getting offering contracts? I mean, I can't imagine a lot can happen in the next 4 years for those kids, but this is what these kids are being, the pressure they're putting under, in my opinion. I don't personally think it's a good idea to do it that way, but that's going to start having some of these kids say, hey, you know what? I need a leg up. And I can see that happening. And again, I just hope I'm wrong. What are anabolic steroids? Known as anabolic androgen steroids, AAS, class of drugs that are structurally related to testosterone, the main male hormone, and produce effects by binding to the androgen receptor. The AR is a protein that binds the androgens like male sex hormones and regulates gene expression, playing a critical role in male sexual development, muscle growth, keeping your bones strong, and helping red blood cells produce. It's a nuclear receptor, meaning it translates the cell nucleus to influence DNA activity. Everybody has them, but males have naturally have more. Testosterone is the most common androgen. Why are they prescribed therapeutically? Doctors prescribe them to promote the growth of skeletal muscle, development of male sexual characteristics for conditions such as low testosterone, certain cancers, or acquired immune syndrome. They can also help estrogen levels lower them, which can help treat estrogen receptor positive breast cancer by blocking the growth of cancer cells. Doctors use these drugs to help treat and delay puberty and improve muscle mass. I actually had a friend of mine, he's my accountant, and his son went through this. He was very concerned when the doctors talked to him because he knew my history. And he said, Danny, this is what they're prescribing my son, pretty much what you guys were taking when you were, lifting weights and bodybuilding. I said, that's interesting. I didn't know that. I never knew the practical application of it. All I knew is that it made us better athletes. That's all I knew. And so as time went on, his son took the therapy, and thank God he did because he actually helped him develop, normal growth and everything else. But he did have a diagnosis that the prescription of anabolic steroids cured the problem for him. They were actually developed in the late 1930s, primarily to treat hyper. If anybody can say that word, I'm going to buy you, a coffee. A condition which testes do not produce sufficiently testosterone for normal growth, development, and sexual functioning. That's exactly what was happening to his son. And then, over time, he, grew normal like any other kid in his age group. There's three types: testosterone analogs, that are derived from testosterone and are known for their ability to promote muscle growth and strength. DHT, these derivatives of DHT tend to have strong anabolic effects while offering reduced estrogen-related side effects. And you do get those from steroids as well. And nandrolone, these steroids derive from nandrolone, which have their ability to enhance muscle mass related to few endocrine effects. And there's a big list of them right there if you can read all that. But there's several of them out there. One thing, because this report's not finished, by the way, this is going to be going on and on. I have some people that are currently taking steroids and are competing, and I actually want to interview them and find out what they're doing, what are their doses of them, what are they doing for testing and everything else. Because here's the problem. Everybody I talk to that are on them, well, I'm doing the right thing. I'm getting my blood tests and everything else, which is fine. You should. But I'm not convinced that that's not going to help prevent problems down the road. And some of the testing, I don't think you can really, a blood test is really going to do it, in my own opinion, because I've seen too much on this journey here. What are the side effects of anabolic steroids? The acne on the skin, swelling ankles from mild fluid retention, stimulation of your prostate, which can cause urinary symptoms such as difficulty peeing, breast enlargement or tenderness in men called gynecomastia, decrease in breast size for women, worsening of sleep apnea, smaller testicles, vaginal dryness, burning, itching, and bleeding, menstrual cycle changes. Don't think the females aren't taking the steroids; they're doing that as well. They always have been since the 1970s. When women's bodybuilding became very, very popular, we had as many women looking for steroids as men. It was all over the place. And there it is. Was this drug, was it designed to be a drug of abuse? That was a popular t-shirt a lot of people had back in the day. Dianabol, the breakfast of champions.
Number one t-shirt, the 60s.
That's right. You know, okay, and everybody raise your right hand if you still have one in your closet. So, give you an idea. Dianabol. This was the first synthetic anabolic steroid. It was meant to be useful medicine. A development of the naturally occurring testosterone was promoted in the late 50s by John Ziegler, a scientist at the Ciba Pharmaceutical Company. It was found to reverse the effects of osteoporosis, elderly patients, and help promote skin growth to burn victims. And that was one thing a lot of people didn't realize. It was a very practical application for Dianabol, especially for people that got injured in the war. Helped out a lot, the Korean War. But it was soon found to also enhance muscle growth. Ziegler supplied to the U.S. Olympic weightlifting team at the 1960 Rome Olympics. Its widespread use to field athletes in the 70s and 80s, it was one of the drugs taken by Ben Johnson on his pathway to the top and to the 88 Seoul Korea's at 100-meter Olympic trials finals. But there were problems. As a former German Olympic athlete, what they found out was simply this, is it would make you so doggone strong, you started having problems with the joints, tendons, and ligaments. Now, to kind of give you a little anecdotal story on this, I was in Palm Springs about this time period before the Seoul Olympics. And I was, out there, talking to a doctor that was, he actually was a doctor for the LA Rams at the time. And he was telling me about steroids. He goes, here's the problem that you guys are going to have. He goes, you're going to find out you're going to destroy your ligaments, your tendons, and your joints because you're putting too much force on them. Is what you're really doing, because your skeletal muscle group, your skeleton isn't strong enough to take this. and you're going to have problems with that. And he's not wrong. Yeah, I've experienced that myself. It was one of the, I remember in the gym, it was on squat day. We decided it would be a real good idea to get stronger in the squat by overloading. So our idea of overloading was to load the barbell up with 1,000 pounds on racket, take 3 steps backwards and 3 steps forward and racket. Sounds like a great idea until I felt my back starting to bend to the pressure. Maybe the muscles could take it, but the skeleton couldn't. And luckily, I didn't do. Luckily, I only did it once. Otherwise, I could have done severe, back damage. And so these are some of the things that are going to occur as time goes on. And you can look at a lot of the former, power lifters. They don't walk too straight anymore. What are the side effects and complications of anabolic steroid misuse? Non-prescribed doses are often 10 to 100 times higher than the doses healthcare providers prescribe to treat medical conditions. This is why the side effects are usually more severe than the side effects of prescribed anabolic steroid use. So what do you do when a doctor gives you a medication and says, if you start experiencing this, call me right away? Bodybuilders aren't going to do that. Athletes aren't going to do that. They're going to ignore it and move on as long as they're getting results. So now you're going to deal with the high blood pressure, blood clots, heart issues, including heart attacks, strokes, liver damage, short stature, if you're an adolescent, severe acne and cysts, male pattern baldness, aggression, mania, delusion, and major depressive disorder, which we've seen those as well. We'll have a story on that as well in this presentation. This is why prescribing steroids to athletes sometimes fails. Again, this is through Dr. Kerr, and I was his patient. Dr. Kerr, the steroid guru, in an interview stated, I used to think that because so many were taking black market anabolic steroids, if a physician gave a little guidance and said to them that a little will give them a lot of gains they want without taking other things, that would be better. He said in an 86 interview. But they take what I prescribe and supplement it with 5 or 6 times other things. I've changed my mind. You can't trust athletes. I know this is true, and I'll show my personal story because we all did it. I'm just willing to admit it. So where did it start for me? Back in 1969 in Whittier. During my sophomore year, spring ball got out. On my way home from school, I noticed something on Whittier Boulevard in my neighborhood. It was a gym. Never saw one before. Jumped out of the car, jumped off the bus, went back to the gym eager to join. And the owner said it was going to cost me $8 a month. I didn't have a job, so the owner of the gym offered me a job at $1 an hour. I didn't care. I just wanted to join the gym. So it was going to take 8 hours to pay a membership fee. I'm going to do it. During this era, going to the gym had very little interest. Most of the members at the Whittier Health Club were ex-cons. We all got along just fine, and jailhouse rules prevailed. At the time, the health codes prevented men and women from working out simultaneously. I became aware of steroids from one of the members who would show up daily with his tackle box full of steroids and syringes, all for sale like a traveling vacuum cleaner salesman. The rules were you must earn the right to take steroids, which meant you needed to peak out naturally first. So we did have a little bit of few rules there on that. The controversy, is there a safe way to take steroids? I became a patient of Dr. Kerr in the 80s as a competitive bodybuilder and powerlifter. Using steroids under the doctor's care made sense. At the time, there wasn't much information related to steroid abuse. Steroids were purchased through the black market, largely from Mexico. I recall showing up for my appointments with Dr. Kerr in the waiting room was a who's who of top athletes in the Southern California area. What could possibly go wrong? We are all required to take scheduled exams and blood tests, lab tests, including blood draws. Here was mine. I'm a 28-year-old male, July 3rd, 81, with a cholesterol level of 446.01. Note from Dr. Kerr, drink more fluids, decrease your egg milk intake. Good luck, Robert Kerr. Now, if you came home from a doctor's appointment and you got this test mailed to you or they told you about it, what would you do?
Drink more fluids.
You drink more fluids. Do you think it would work? Don't forget the patient's 28 years old. You know, that's the cholesterol, somebody about to, go over the cliff. And that was the only test like that. I have two of them that says the same thing. Did it make Dr. Kerr a bad man? No, because I don't think he knew either, to be honest with you. He might have thought this was just an enigma. But that stuff, man, the doctor's putting you on medication right away, no medication. When did steroids become a household name? In the 80s, steroids became a household name. Popularity spread way beyond competitive athletes to teenagers, female athletes, middle-aged men looking to increase their libido. I got a story on that one. We literally had a doctor in the gym. I'm not going to use anybody's names because he has family still alive, and I'm not going to do that to him. He was prescribing steroids to himself. For some reason, he was in his mid-50s, and he was trying to vicariously live through us, I guess. So he wanted to train with us and all kinds of stuff. And one day he's an alcoholic as well. So he comes to the gym, and all of a sudden I get a phone call. Hey, the doc just, they had to rush him to the hospital. I think he's dead. He had a cerebral aneurysm in the gym. So I rushed down there, talked to my buddy. I said, man, what are we going to do? I said, let's go clean his locker out. Not only did we find steroids in there, we found liquid amphetamines. The man literally prescribed himself to death on these types of things. And this was getting way, way carried away, needless to say. According to Dr. Kerr's book in 82, The Practical Use of Anabolic Steroids with Athletes, he wrote that he treated more than 4,000 athletes from 20 countries at the 94 Olympic Games. It should be 84, typo there, in Los Angeles, won medals at the 88 Olympic Games in Seoul, Korea. The men's 100 race, which simultaneously tested positive for Stansible, which was awarded to Carl, which later awarded to Carl Lewis, who had also tested positive for stimulants as well, but levels then consistent with acceptable. And then in 1967, the IOC banned the use of performance-enhancing drugs. But the public was not really aware of this, in my opinion, until about the 80s. So then we had a controversy from the same games in 88, FloJo, for a record break. If anybody wants to question if she was on steroids or not, you can go to Google and YouTube her performances. You're going to have a hard time imagining somebody that's actually spanking the competition by a long shot and winning, because the controversy is, did she ever take steroids? Well, we can never prove it because she tested negative. She faced allegations of performance-enhancing drugs due to the dramatic improvement in her speed before the games. Well, she passed all drug tests. Her autopsy after her death did not reveal any banned substances, which was years later, by the way. The controversy surrounding her success continues to this day. FloJo died in her sleep at the age of 38, victim of a form of epileptic seizure that led her to suffocate. One misconception is, can you die from steroids? No, it's the side effects caused by steroid use. We will never know if FloJo used or not. I did watch the 88 games. I saw the interviews with FloJo, and yes, I do have an opinion. I'd never seen a female with a deeper voice than she had during the.
A muscle cut.
Yeah, she's muscle cut. Yeah, so I mean, it's I always could tell people I could smell a steroid a mile away, so you can't snow the snowman on that. But then again, that's I don't want to disrespect her family either. Some of the most commonly used anabolic steroids among bodybuilders includes testosterone, dianabol, anadrol, testosterone, turbinol, webtrol, anavar, decadrobolin, maxtrol. Now here's the kicker. Also equipoise. Equipoise is an injectable steroid that promotes steady muscle gain. Equipoise is a horse steroid. And a lot of people were aware of that. There was an Olympic hopeful out here in Orange County, and I met him, and he was severely handicapped. He almost drowned out in Newport Beach. He was on steroids out there swimming in the ocean, almost drowned because he had a stroke while he was swimming. And they saved him, brought him back. I asked him, I said, well, what happened? He'd go, well, I was taking steroids and, I thought I could get ahead on that. I said, what were you taking? He goes, oh, I was taking something called equipoise. And I told him, I said, you do realize that's a horse steroid? He goes, no, I didn't know that. And he said, yeah, it's probably had to do with it. So he had a massive stroke, never recovered from it. Here are several signs that might indicate someone's using anabolics. Rapid muscle growth. Users often gain muscle mass much faster than natural lifters. Disproportionate upper body development. The shoulders and trapezius muscles tend to grow significantly due to the high concentration of androgen receptors. Acne and oily skin. And that's the first thing I noticed right away. They get that acne and that oily skin, all the barbell, you got to clean it off first. Hair loss, flesh skin, elevated blood pressure from steroids can cause a reddish in the complexion. Mood swings, roid rage. Some users experience heightened irritability and aggression, gynecomastia, enlarged breast tissue in men. Some steroids convert to estrogen, leading to breast tissue growth. Now, here's an interesting character right here. This is what I'm telling you, I can smell it a mile away. Here's the before and after picture. Does this guy look like this guy? Rookie year, end of career. Barry Bonds. Significant difference. We all know someone who died from steroid abuse. One of the best known deaths associated with steroid abuse was Lyle Alzado, who died in 92 at the age of 43 from brain cancer. And this is why I tell people, I said, you can get a blood test on your cholesterol and your lipids and stuff like that, but you can have cancer cells growing in you. I don't think you want to have a PET scan every 6 months, but these are some of the things they're not going to detect. So it's not foolproof. Which attributed to his use of performance-enhancing drugs, including steroids. There's no secret Lyle had a short fuse, demonstrated by his aggressive temper on the field. His behavior, now known as the Alzado rule, inspired the NFL rule against throwing a helmet after doing so to an opponent's helmet. After his death, Lyle Alzado became, before his death, Lyle became a foe of steroid use on that. I had the opportunity. No, I actually did. Before all the stuff came apart, I actually met Lyle Alzado, given one of our bodybuilding competitions. And when you talk to him, he's a very nice person. He didn't, what he did on the field, it was like night and day. But it was because I had a chance to meet him as a normal person, I really felt sorry for him because I knew that wasn't him. I knew what the steroids were doing to him. The NFL didn't begin testing for steroids till 87. Didn't suspend anyone until 89 and didn't start a year-round testing until 1990. Since 2001, NFL players have been suspended for performance-enhancing drugs related to substance at least 258 times, including at least 82 times in the past 5 years. That's an article from USA Today on February 2022. And then several sports leagues, professional, have since placed similar rules in place. Here's one of the situations, and Dick Butkus talked about this kid a lot when I met him out in Orange County to my doctor's office. He said, Danny, here's the problem. There's how many Taylor Hootens are out there? In March 27th of this year, the Food and Drug Administration estimates there's about 375,000 young men and 135,000 young women in high school abusing anabolic steroids. That's a big number every year. Taylor Hooten was 17 years old when he took his own life. I know that's kind of hard to read all that. I'll kind of use the Reader's Digest of it. Taylor was an aspiring high school baseball player who wanted to, go up to the next level. He was encouraged by an associate to start taking steroids to get him to that next level. And then his parents started noticing his behavior was not him, which is one of the side effects. Now you got to remember this kid is 17 years old. Is his brain fully developed? Not even close. And now he's going to introduce steroids to his system. So what's he really doing? This is like taking a 17-year-old kid and say, you know what, 5 years ago you went through puberty, you're going to do it all over again. So then he gets the aggressiveness along with it as well. He gets in a little bit of trouble with his parents. They took him to a psychiatrist. He actually confesses to the psychiatrist, yes, I'm taking steroids. And also at the time, that's back in 2003, they knew some, but not a lot. And they attributed to some of his problems about steroids. So he quit taking them. His parents punished him somehow. And then what he did, he couldn't deal with it anymore. He went into deep depression, had the roid rage and everything else, deep depression, hung himself in his bedroom in that particular year. So this is some of the aftermath things. You don't see it, but it happens. Now, again, going back to this stuff, is I've talked to a lot of athletes. In fact, there's one that was with USA Weightlifting, and gentlemen, I'm not going to repeat his name. I actually like the guy, but I even told my son, this kid's on steroids. Dad, how do you know? He says, I just know. He's on steroids. Later decides to has some success. I don't know how he never got caught, but he didn't. Decides to become a bodybuilder. At age 26, I think, if I'm not mistaken, has a heart attack. And the doctor tells him that, he even posted on Facebook, it was from the steroids. And then he goes into a deep, dark depression. I hope he's okay today. I haven't heard from him since. But that was a case of a kid that, nice kid, I liked him, goes on steroids, something goes wrong, gets off him, goes into a depression. This happens a lot with athletes. Well, I'm going to cycle on and off them. I said, well, maybe you can. But there's a lot of people that I've talked to that have tried that. They cycled off. They got so depressed. They tried to go back on them again, and it just got worse and worse and worse and worse. So the psychological effect for a lot of people is not good. It's just not good, especially if we have this environment today to where kids are being pressured to get that next level. You want that nil contract. You got to beat these kids out. This is an appetite for disaster, in my opinion. I hope I'm wrong. Here's the rest of the story. I've had to say goodbye to many of my friends and associates because of steroids. After a major bodybuilding competition in '82, my training partner, Glenn Maurer, and I talked to his daughter. She said, it's okay. Was admitted to the hospital due to a heart attack. It was conclusive that Glenn's steroid abuse was the cause of his heart attack, because now they're able to put two and two together. Prior to that, not really. But now it's because they had enough studies on it. And actually, my cardiologist has done a lot of studies on it too. He's got a lot of bodybuilders that went through his office and did these body scans, and he can see these guys, they're just a heart attack waiting to happen. So bypass surgery was necessary to save Glenn's life. At the time, Glenn was 33 years of age. Like me, Glenn was a patient of Dr. Kerr. Glenn, now after his heart attack and everything else, Glenn started spiraling downhill. He started dealing with bouts of depression and anger. The anger was so bad, I did not even recognize him as my friend anymore. It got that bad. Unfortunately, in 2011, at age 61, Glenn finally passed away from heart failure. In my case, shortly after Glenn's heart attack, I retired from competition, primarily from an accumulation of injuries, which were probably brought on by tendon and ligament damage and a lot of joint damage. My neck and back looks like a train wreck. I mean, thank God I can still walk around and function today on those kind of things from accumulated injuries. Retirement also meant retirement from steroids. I thought I dodged a silver bullet, but not so. In 1989, after a training session at a gym in Diamond Bar, California, I suffered a heart attack in the parking lot. Thankfully, a friend of mine, Darren, was coming down from the gym. I'm honking my horn. Darren loaded me in his car and drove me down to Pomona Valley Hospital. They didn't think I had a heart attack because how can a guy in this kind of physical shape have a heart attack? And actually, they did the blood test. They said, yes, indeed, he did. And we talked about my history. Said, yeah, this is linked to your steroid use. You have your 95% blocked in 3 of your arteries. The other one is not so bad. It's only at 80%. So they had to do bypass surgery. But that's not the rest of the story. Like Glenn, the cause of the story was I was 36 years of age at the time. Bypass surgery was required. Heart surgery was a blessing in disguise. During the bypass surgery, it was discovered that I was born missing an artery and a transplant was performed. This condition is what Pete Maravich died from, missing an artery at birth. But here I am today at age 72. I've lived half my life with heart disease. The best medicine is attitude. I've seen what other people have gone through and they completely lose it mentally. I didn't. We also have ethic concerns. The unfair advantage, that's why we have USADA and WADA and things like that. Health risk versus performance. So you got to ask yourself the question, are you trading something off that you're not aware of? Athletes often face a dilemma between short-term gains and long-term health consequences that they're not aware of. Pressure on the young athletes, and this is where my biggest concern is, the normalization of steroid use can push high school and college athletes to take dangerous risks. Integrity of sports. This is why they have rules and bans against it on that. Physical health concerns, cardiovascular issues, high blood pressure, heart attacks, and strokes. I've had all of them. Liver damage. I've known a lot of athletes that have died from tumors in their liver. Hormone imbalances, with all the things we talked about, with men and women, that they can have it. Kidney problems, also leading to kidney failure. And of course, the severe acne skin issues. On the cancer issues, a lot of people had, I've seen this happen more than once. The people would have cancers metastasize and die from brain cancer. Saw that on more than one occasion. And of course, it was attributed all the way back to steroid use on those. Pat, you know Bill Ennis, don't you?
That
Bill Ennis, okay. Bill Ennis is a really good friend of mine. I know him for years.
I know Bill.
Got to know Bill through powerlifting. So what would happen is about once a month, I'd get a phone call from Bill Ennis. I started calling him the Grim Reaper. Every time Bill would call, he would say, Danny, so-and-so passed away. His funeral's going to be at Rose Hills on Tuesday at 5 o'clock. Could you come over? Yes.
So there was a span of time there, and it was pretty consistent. They're all dying in their late 50s and mid 60s at the time. And it was all from the same cause, I firmly believe, because when I'd asked Bill, I said, what happened to them? Well, cancer, stroke, and things like that, but a lot of cancers that just went totally undetected. And that was really the one that came up at the very last. Death rate. Studies suggest that anabolic steroid users face a higher risk of premature death compared to non-users. Research indicates that steroid users are 3 times more likely to die early than those that don't use them. 2.8% of steroid users died over an 11-year period compared to 1% of non-users. That's kind of your deal there. The cause of death among users include cardiovascular issues, psychiatric complications, accidents, and suicides. Mental and emotional effects, aggression, mood swings, roid rage. I've seen people lose their friends, their families, their wives, all for the same reason. Can't stand living with him anymore. He's out of control. And she's out of control. There was a documentary, I can't think of it. It actually happened. It happened while I was living in Oceanside back in the late 80s, early 90s. There was a female bodybuilder down there living with her boyfriend, who was also a bodybuilder. And she freaked out one day because he was cheating on her. And it's a true story. So he comes home and she greets him with a shotgun and blows him away brutally. And she emptied ever how many shells that shotgun held, she used all of them, which was about, I think, 6 or 8. Depression, anxiety, the withdrawals can be, terrible for mood disorders. And some people get so psychologically dependent on them, they can't get off them. And those are the ones that wind up with a lot of big problems. They just can't get off. And they can be retired and they still stay on. Tendon damage, we talked about that. Can weaken the tendons, increase the risk of injuries. Cholesterol imbalances. I think the test I showed you proved that one. And here's my conclusion. Are they dangerous? Well, it depends on who you ask. Like cigarettes, warnings are printed on each package of cigarettes, yet people continue to smoke. Studies today address the dangers of non-therapeutic anabolic steroid use. The problem with the science deniers is success when experienced while on anabolic steroids. Do anabolic steroids work? Oh, hell yes, they work great. There's no question about it. It all seems okay until something goes wrong. Is there a safe way to take anabolic steroids? We thought so, but the results said different. The addictive nature of anabolic steroids become apparent when it is not enough. I remember when anabolic steroids were commonly used, the only commonly when used was dianabolic testosterone, decadrobin, and winstrol. Then came equipoise, a horse steroid. That's exactly what I'm talking about. When is it enough? And later HGH. Bodybuilding became all pharmaceutical at one time, and I think it still is today. I just talked to a bodybuilder in the gym on Saturday. He goes, Danny, it's still all pharmaceutical. I says, well, I can see that. So the art of training to sacrifice got out the window. So much so that the competitors started to look like cartoon characters. Hence, several premature deaths were reported. On the other hand, some abusers have not, or maybe will never experience any negative side effects at all. And I know some people that same era I was and nothing. I mean, this is like the guy that's 95 years old and has smoked a pack of cigarettes a day since the age of 16. There are people like that. So you can't say on one particular person is going to affect everybody the same. That's not true. It's not true at all. But the question is, where do we jump in and educate people on this stuff in a way to where they can at least have some evaluation on what's really going on, because I don't think because I mean, let's face it, they're not going to test every kid all the time, and they're looking for that opportunity. Uh, and sometimes they're going to use steroids to help get there. That's a foregone conclusion. So that's it.
Okay. Pop your screen off and we'll go to some questions. I do have one.
Okay, how do I blow our listener back? See. How's that? Do I do something else to get out of the screen?
No.
Oh, stop share. Never mind. Found it.
There you
There.
go. So, interesting, Dr. Kerr. Dr. Kerr had a stepson that was playing when my brother-in-law, my wife's brother, was in high school at Arcadia High School, and he gained about 25 pounds from June to September, or August when they started playing, and he doped him, he drugged him. Now he ended up tearing up at first he tore up a thumb, then he tore up his ankle, and he ended up never finishing the season because those are things that happen. I saw a thing, and I'm not sure exactly what it was, a couple weeks ago, that they're coming out. And I don't know if you know anything about this. There's something new coming out that's going to work just like steroids, only they say it's not going to have the negative effects. Have you heard anything about this thing?
I have heard that. There was actually something that I saw during research, and I wanted to look at that's why I say this thing's not over. I got more chapters to put in this thing because there are things like that. Now, the first time I heard of that was probably about 10 years ago. I got a phone call from, I don't know how they got my number. It says, you really need to try, you really need to try this. This is a replacement for steroids. I go, sir, no, I'm not going to do that. He goes, why? It's safe. I said, I don't buy it. Have somebody else be your guinea pig, and then we'll see what happens after a dozen years. Those things, but yeah, there's about 4 of them actually out there. One's actually called like D-ball, stuff like that. So they even got the names kind of close. But there's about 4 of them.
It'll be interesting to see where that goes. Anybody else have a question?
Thank you, Danny. It was very informative.
Well, thank you. Yeah, because you got to remember also Balco, that they had their thing going too, and look how that went.
Malco is a whole different world.
Yeah.
I got a phone call one time. Won't tell you who made the phone call, but Greg was training, and it was from Colorado. I will tell you that. And they asked me if he was buying any supplements from Balco, and I looked out. I said, "Hey, Greg, you buying anything from Balco?" He said, "No, no." About a week later, they busted Balco.
Mm-hmm.
They were literally calling all of our athletes to ask them who was using Balco supplements. So that was a really interesting. When they busted them, I looked at Greg and I'm going, "Holy shit!" This is like crazy. We just heard this last week. So somebody had a upfront thing about them. What they said they did on the Balco thing is they had a sprinter who they caught him. They knew he was doing it. So he turned to state's evidence, and what they did is the guy from UCLA, they had this stuff called the clear and the cream. And what happened is by the time you put it in the spigometer thing, it dissipated and it didn't show up. So the guy from UCLA created a test to find it. And once they got that, they had to have some of the stuff in order to create the test.
Oh yeah, they had to, because they didn't know how to test for it.
And I won't tell you who the sprinter was either, but it was one of our best sprinters. But I got the inside dope on that one.
Mm-hmm.
And then they started taking them out. When they took them out, they found they went in the office, they had all their files, but then they found a secret door to a back office. They had the other files. And the other files had every guy that was on it, every athlete, every guy, every girl that was on it, you know. So, and as you know, Barry Bonds, his strength coach, went to jail for providing it. Yeah, that stuff was for real.
No, we literally had a guy, he's a really nice guy, man. I felt sorry, he got arrested. And his mother was a doctor from East Germany. And they had a, what do you call it, a art studio, where they, sell art and stuff like that. Great front. She would ship steroids from East Germany, Winstrol B, in the bucket loads. And that's how he made his living selling it. And so I got a phone call one day, says, Danny, they got him. They got who? They gave me his name. I said, for what? They caught a huge shipment of Winstrol B coming to the art studio. This is after they reclassified everything.
Oh.
Yeah, a lot of people got in big trouble.
Well, if there's no more questions, I really wanted to get into neuroplasticity of the brain.
I just wanted to tell Danny, I
Okay.
know the gentleman that he was talking about that went off steroids had a heart attack very young, and seems to be doing fine.
Oh, he is now. Okay.
He's got a family. Yep.
Yeah, because I got off of Facebook, so I never knew what happened to him. And I
Yeah.
always wished him well because, I mean, he's a nice person. He just got, snake bit, as I call it. He got snake bit.
Yep. But he's doing well. So wanted to let you know.
Thank you. I appreciate that.
All right,
Sometimes
Larry.
I ask, I don't want to know. It's one of those things. But
Okay.
Julie, thank you so much.
Anyway, Larry, let's go. Go ahead.
Well, I apologize for the last meeting. I woke up Easter morning and had some joint inflammation, and I was